So I'm so excited to hear about this topic. We have a really fantastic speaker, and so please welcome, he's a neuroscientist, psychiatrist, health tech entrepreneur, and inventor, Dave Rabin, everybody.
I want to make sure that everybody takes away two real things from this conversation, because we're going to do a deep dive into the neuroscience of resilience, chronic stress, how to become our best selves, how psychedelic medicines and technology can help facilitate that. But what this really comes down to is accelerating adaptation. Because accelerating adaptation and adaptation itself is probably our most critical and important human skill. We have lots of skills that we can, potentially infinite skills that we can become good at as human beings, which is amazing, makes life rich and exciting. But adaptation, particularly when we adapt to anything that comes our way by connecting with other human beings to figure out how to overcome great challenges, complex problems. This is the strength of why we are human beings. This is what has gotten us to where we are today. So I want you to leave here today, my hope is that you leave here today with an understanding of why adaptation is so important to the future of the survival of the human species, and in large part, what trauma means. Because trauma, in a lot of ways, is our biggest barrier to actually creating struggles to adaptation. And everything that goes along with misunderstanding trauma and how to overcome it is a big part of that, and stigmatizing it, making people feel bad about being traumatized. I can't think, as a psychiatrist, I can't think of a single person who hasn't experienced trauma that I've met, ever. It is a thing that's universal to the human experience. So, I just want to start by letting everybody know I am a practicing psychiatrist. I am trained ketamine assisted psychotherapist, trained MDMA assisted psychotherapist with MAPS. I am a neuroscientist. I conduct multiple research studies. I have about 15 clinical trials ongoing right now across all different areas of psychedelic medicine and wearable technology. I'm also the Chief Innovation Officer and co-founder of Apollo Neuroscience, and have patents on the technology. And I'm the Executive Director of the Board of Medicine, which is a nonprofit that helps to basically bridge the gap between Western medicine, Eastern, and tribal medicine by creating guidelines to help us understand how we can use these powerful healing tools more effectively and without judgment, or at least less judgment. So, first off, why are we even talking about this? Well, the reason why we're talking about this is because Western medicine is really, really good at fixing certain problems. This person had a very, very severe and serious cancer that was removed surgically, and they survived, and they went into remission and lived a good long life. But they also suffered a tremendous amount of emotional and mental stress that was not tackled by the Western medical system. In fact, it was completely ignored. And what Eastern and tribal medicine have to offer us, while Western medicine is incredible at taking care of things that are emergencies, things that are about to kill us, or things that could really mess up our lives in the short term, infections, accidents, injuries, surgical procedures, and things of that nature that need to be treated right away. Eastern and tribal medicine have an incredible amount of evidence, actual evidence, that are offered to the whole understanding of health. Health is not just Western or Eastern or tribal. Health is a whole, and it means balance. And that's the root of the word health. Savathya from Sanskrit is really focused around the understanding of restoring balance for bodies. So, just to give you a quick catch-up of where we are today in the space, we founded the NIMH, National Institute of Mental Health, in 1949 to treat shell shock, which is now known as PTSD and traumatic brain injury. We still, to this day, only have 2 FDA-cleared medicines that can be used as the gold standard in Western medicine to treat these conditions, and unfortunately, they have tons of unwanted side effects. They require chronic multiple times, or sometimes multiple times daily dosing. And the remission rates in terms of people actually recovering are less, in a lot of cases, less than 30%, but in most cases less than 50%, which means that after 2 or more trials of these FDA-cleared medicines, which are the only medicines we've had for over 17 years, over 50% of people are not getting better. That is not just discouraging for patients, it's discouraging for us, because we went into this profession to heal people. And if we're taught to do something as the gold standard way, and people aren't getting better, it makes us feel like kind of shitty. And so we forced us to ask the hard questions, back in like, let's think in like 2010, 2012. Is it possible that the way we're thinking about trauma and conceptualizing it and approaching it is totally off base? Maybe there's a different way to think about trauma. And so I will pose this different way of thinking about trauma to you in a way that helps us understand the way psychedelic medicines work and psychedelic experiences work, as well as the way that technology can help facilitate these experiences and the healing process as a whole. This picture is not unfamiliar to most of us. This is somebody who, let's call him Tim, and he's been working really hard, and he's overwhelmed, and he feels like he's on the verge of burnout, doesn't enjoy his job anymore. He's really just not gratified in his life, and he's just feeling like not well, not good about the way things are going. And the way the body responds to that is it increases our resting heart rate, it increases activity in what we call our sympathetic stress response nervous system, the system that's supposed to really only kick on when we're running from a lion or a bear or we're in a survival situation. And that system is, in Tim and many of us at different times, is turned up all the time. So Tim's results are poor sleep, poor focus, mood sucks, and it's HRV, which is one of our most reliable biomarkers that I'll get into later of how to track the effects of resilience and chronic stress, actually goes down, which means he's less likely to recover quickly from stress and adapt. HRV is actually one of our best metrics of adaptation. And I don't need to tell most of you this. These are the numbers from I think it was 3 years ago, of the toll of chronic stress in the US alone. This is not good. This is actually a completely avoidable tragedy. And so perhaps thinking about the way that chronic stress impacts all of us, and the way that all of us have lots of things going on in our lives where we do know we're going to be under stress at different times, and that stress is going to be a lot. Maybe let's think about trauma a little differently. Maybe trauma is actually just a past experience that we continue to look back on and feel is deeply traumatizing, which is a really interesting definition that came from Dr. Rachel Yehuda, who's one of my colleagues and leader in the field and director of trauma and psychedelic research at Mount Sinai Hospital in New York. And the reason this definition is important and different from the way that we think about trauma now is that many of us will have a very difficult experience and say, I've been traumatized. In the moment, we often say, and we can catch ourselves and say, I've been traumatized. That experience was traumatizing. Raise your hand if you've ever said that about an experience you've had. That's pretty common. So the reason why it's important to be conscious of the language we use about ourselves is because our language literally creates our reality. The words we use to describe our experience and ourselves is how we see ourselves and how we see the world around us. It creates meaning, and that stores in memory in our bodies. So what this is really redefining trauma as is something you can't tell is traumatizing in the moment because events that are challenging can actually help us grow. So just because something is very, very hard right now, or very, very challenging right now, or maybe like the hardest thing we've ever had to do, doesn't mean that it's going to result in long-term symptoms that turn into something like PTSD or depression. It means we're having a really hard time right now. And so remembering that the way that we use our words changes the way we understand ourselves and the way we see ourselves is critical to the healing process. And this affects physical, mental, emotional, and spiritual. And trauma results from this is the more standard definition that we put together from all of this work, is that it's one or multiple intense, meaningful, and threatening, which can be what we perceive as threatening, like traffic, or annoying emails from our boss, or our kids screaming, or actual threat, like being chased by a lion or somebody we don't want to be chased by, over time. Intense means highly concentrated or high density amounts of stimuli, big, intense experiences. Meaningful is critically important. It's self-relevant or self-referential. It impacts the way we see ourselves, or it can impact the way we see ourselves. threatening is, again, the perceived or actual fear of survival. It doesn't necessarily matter, by the way, if it's actual or perceived. If there's a sense of threat and all of these other conditions are met, then you can have a traumatizing experience, but only after looking back at it in the past to understand the effects over time. So what does this do to the nervous system? We know that chronic stress trains the nervous system to be in a fight or flight state for a lot of the time. Because when we look at animal models have been studied for over 100 years, and human models of research, we know that people under stress have a boost to their fight or flight or freeze sympathetic nervous system. This nervous system is critical for getting us out of survival situations. So effectively what this means is, if you imagine, take yourself back to the jungle for a moment. There's no phones, there's no Apple Watches, you don't even necessarily have shelter. You're kind of trying to figure out what cave is safe to sleep in and doesn't have a bear. And, well, when you sense that a bear is there, you want all of your blood and oxygen and resources and energy in your body to be diverted directly to your heart, your lungs, your motor cortex of your brain, your fear center of your brain, that gets you, your skeletal muscles, gets you immediately out of that situation right away, as quickly as possible. Because that could mean your ability to continue to survive and reproduce, or the end of your current run on this earth. That is why the system evolved. The other part of that is that when this system is engaged, we only have so many resources. So all the resources that are going to getting us to that survival state are getting taken away from reproduction, creativity to some extent, immunity, the immune system, digestion, because we only have so many resources. So that energy has to come from somewhere, and you don't want to be thinking about reproduction and having sex when you're chasing by a bear. That would defeat the whole purpose of evolution. We might not have made it to this point if that was the case. That system exists for a reason to protect us. And I'm sorry you can't read this slide very well, but ultimately, this is the fundamental balance between the sympathetic and parasympathetic nervous systems. The sympathetic stress response system I was talking about is right over here, and the parasympathetic is right here. They balance each other all the time, whether you're aware of it or not. Things that we are at the center of that balance. The things that we're exposed to and the things that we do, breathwork, meditation, mindfulness, yoga, things like Apollo, soothing touch, empathic listening, eye contact with a loved one or even a stranger, all of these things help us feel safe, which boosts activity in the parasympathetic nervous system, which is why more people in the US are suffering right now from isolation anxiety as a result of COVID than any other time in this country's history. So how do we fix it? Well, that's not easy, right? But what you can see is all of these strategies, like deep breathing, meditation, float tanks, yoga, soothing touch, sound and music, vagal nerve stimulation, empathic listening, and the one that's cut off is Apollo and vibration, are all capable of restoring that balance of our stress response system, which you can measure as decreased breath rate, you can measure it as decreased resting heart rate, and you can measure it as increased heart rate variability, which is a sign that the body is being trained to be more resilient over time. Stress, remember, knocks down heart rate variability, which is the time between each heartbeat. You can measure it with an Apple Watch, you can measure it with a Oura Ring, you can measure it with some Fitbits. It's one of the most popular metrics that's tracked right now, but it's not really used in Western medicine yet. And so the important thing is that all of you understand these are some of our most powerful adaptive skills, and by practicing them over time, we actually are rewiring our nervous system to be able to adapt to stress more effectively, to literally be that much closer to our highest potential, greatest possible self. And so this is a semi-deep dive into neuroscience, but basically, in short, we're threatened. And when we're threatened, it stimulates our amygdala, which is at the fear center of our brains. It's a part of our brain that dates back to ancient reptiles. Many people refer to it often as the reptilian brain. And the amygdala detects contrast. It detects newness. And newness is scary because it produces uncertainty. So when we have a potential threat, it triggers the amygdala, signal unfamiliarity, which triggers emotional memories, and the insula, which is the part of our brain that is responsible for empathy. It's a part of our brains that's responsible for interoception, being aware and feeling our bodies, our heartbeat, feeling our gut, feeling our breath, and it triggers the part of the other part of our brain is introspection, looking inside yourself. And this triggers sympathetic activation when you perceive threat, which starts a loop that many people can turn into anxiety attacks, panic attacks, you name it, not wanting to get out of bed. There's lots of different outcomes here. Safety, on the other hand, triggers the insula first. So this is the emotional memory storage center of the brain that says, I'm safe right now. I have the ability to self-regulate, because if I was actually not safe, I wouldn't have the time or the ability to pay attention to my breath. I wouldn't have the ability or time to pay attention to this person hugging me, because my body wouldn't let me. I would be running from that lion. But if there's actually no lion, then all of a sudden, triggering the body with these safety techniques I mentioned earlier can cause rapid restoration of the body. Many of these techniques are hard. And so what's important about all of this is that safety is the foundational process of healing. If people don't feel safe in the healing process, whether you have drugs involved or not, we don't get better. In fact, we actually struggle to adapt and we struggle to change. So we have to hit the safety stuff first, whether we're doing it for ourselves or for others, so that we can make sure that people's bodies are optimized to be able to change and adapt. Safety facilitates also non-judgmental access to our subconscious memories, which also in turn facilitates healing. So, let's get to the fun stuff. What does psychedelic mean? This is one of the most commonly misunderstood words in the English language. Psyche means mind. Delos means show, to reveal. So psychedelic actually means to show or reveal the mind. Why is that interesting? Well, because that is not a drug-dependent experience. In fact, the most common ways that we experience psychedelic states are actually in our dreams. Our dreams we've experienced since we were small children, maybe before we can even remember. And these dreams are literally, when we go to sleep, our default mode, ego-centered, day-to-day survival brain networks get turned off, and when those get, which is the same thing that psychedelics do, and the same thing that safety does, and when that happens, all of a sudden, that safety of knowing that we are able to sleep, sink into a deep restorative sleep, opens up our awareness to have access to all of this subconscious material. Imagine that our awareness is an iceberg, and at the tip of the iceberg is only what we are consciously aware of, what you're listening to right now, what you're seeing in this room right now. But then the rest of the iceberg is all underwater for a reason, because if we were aware of it all the time, it would be really distracting. But ultimately, all of that is still within our awareness. It's just what we call subconscious. It's beneath awareness. So the goal of psychedelic states is actually, and historically, tribally, is to expand our awareness, to show us that we can become, at any time, aware of everything else that's going on around us that we are not normally aware of. And most importantly, it does not require drugs. You can get it with dreams, you can get it with meditation, you can get it with yoga, you can get it with extreme sports, you can get it with lots of different things. Soothing touch, massage, sound baths, there's tons of ways to access it. Psychedelic drugs are the biomolecular way to induce these states. And I think the other thing that's really important to talk about here is that psychedelic drugs are most accurately described as non-specific amplifiers of our consciousness. So why is that important? Because ultimately what we bring into our psychedelic experiences, whether they're drug-induced or not, is what gets amplified by that psychedelic experience. If you bring in fear, if you bring in incredible sadness or feelings of being threatened by yourself or others, or you name it, that is what the drug amplified. If you bring in safety and love and gratitude and forgiveness and compassion for yourself, for others, that is what the drug will amplify. That is what the psychedelic state amplified. So this is critical to keep in mind, because not all psychedelic experiences are pleasant and fun for this reason. Psychedelic plants, as many of you know, have been used in ceremony, coming of age, community building, healing trauma, treating chronic illnesses for years all over the world. And what's really interesting that most people don't know is that synthetic psychedelic medicines like LSD were actually discovered in the 20th century, in the early half of the 20th century, because we were trying to figure out how the nervous system worked and trying to treat these really, really hard to treat conditions that we didn't have any solutions for. And so many of these medicines were actually discovered by accident, but because of those discoveries, that work actually turned into discoveries that led to almost all of the Western psychopharmacological interventions that we currently use today. SSRIs, selective serotonin reuptake inhibitors, Prozac, Zoloft, tricyclic antidepressants, MAOIs, antipsychotics, almost all of these medicines were discovered because of the discovery of psychedelics. And yet, they don't get these kinds of results. This is what we're seeing from the clinical psychedelic work that is going on and has been going on for the past 12 years. We're seeing for psilocybin and MDMA, with just 1 to 3 doses, plus some psychotherapy and some guidance, we see reduced symptoms of depression and PTSD, and that's not a 80% for MDMA, it's a 60%, but we see at 1 year out, and I apologize, an error on that slide, it's not 5 years out, 1 year out, over 60% of people in the MAPS phase 2 trial with treatment-resistant PTSD for on average 17 years. People have tried everything, never gotten better, which is 3 doses of MDMA and 12 weeks of psychotherapy. At 1 year out, over 60% are currently in remission. Still, with no additional treatments. There is nothing even close to that we have ever seen in the history of psychiatry. It is truly incredible. And psilocybin has shown very similar results in depression, and ketamine, when combined with psychotherapy, is also showing very similar results, which is extremely exciting. What's really interesting is, even though we're looking at 2 different drugs here, one of them is synthesized in a lab, and the other one is grown everywhere, they're both inducing similar experiences of people that are reported from the subject, feelings of complete safety and acceptance from themselves and the world, improved feelings of connection to self and others. They're rated as one of the most powerful experiences of people's lives from one psychotherapy-guided psychedelic experience. And what's really interesting about MDMA is that many people who came into the MDMA trial in the early days, the early phases, would actually say that they didn't believe it was the same drug because the combination of the MDMA with the MAP psychotherapy protocol was so powerful that it completely changed their experience and their lives, that they so much that they did not believe it was the same drug they had taken at raves. So, this is the summary, briefly, of the results I just shared with you from the MAPS phase 2 trial. 2 months post-treatment, 52% of the MDMA group with 17 years plus on average treatment-resistant PTSD are no longer meeting diagnostic criteria for PTSD. That's 2 months out. While their placebo group, only 27% of those people were no longer meeting diagnostic criteria. It's still pretty good. Those people just got therapy, no active drug, no full dose of MDMA. It's pretty incredible. That means the therapy alone is still pretty darn good. However, the proof is in the pudding at 1 year. You see, the group with 52, the group that had the actual MDMA with just 3 doses, not only maintained their symptom remission, more of them got better. It went from 52% to 67% at 1 year out. Whereas with the placebo group that only received therapy, over half of them relapsed again. Which makes you think, perhaps, maybe the way the therapy and the medicine are working together is that the medicine helps us as therapists actually teach the client how to heal themselves. Because these people have not had any additional treatment. How is it possible that more of them could be getting better without additional treatment? There is not a single study in psychiatry with Western psychiatric medicine that shows that this is possible. They all show the opposite results. So it's really paradigm shifting for the field. And truth be told, psychedelic medicines have shown greater promise to to treat disorders of trauma than any medicines ever studied. Ever. Think about that. It's incredible. It is absolutely incredible. And it is so good that this is happening right now. Thank you, Rick Doblin, for all your hard work getting this through the FDA. He is the man. And the whole Matt's team, of course. And so, then we get into the good stuff, right? How is medicines working? So, many of you have heard of the default mode network. I mentioned it earlier. The default mode network is a way that different parts of all of our brains, every human being, and probably most animals, have a network in our brains that is just running by default, which means when you just kind of sit there daydreaming, you just at rest, and you're not doing anything or thinking about anything in particular, this is the network that is most active. And it's basically a bunch of different parts of our brains that talk to each other to keep our normal ego, sense of self, consciousness intact on a resting basis. This is the network that is also very interestingly shown by folks at the Imperial College of London, Robin Carhart-Harris, and David Nutt and their team, that people who take psychedelics in the proper setting, and actually without therapy at all, that the psychedelic medicines disrupt the way that this network's talking to each other. It doesn't turn off parts of the brain. If anything, it might turn on parts of the brain, but that doesn't really matter. The on and off, it's not that interesting. What's interesting is what turns on at the same time, what turns off at the same time, and how are these parts of the brain talking to each other? So, think about it. Imagine for a moment that thinking about the world and thinking about yourself is actually, every time you do it in the same way, it's like skiing down the same slope over and over and over again. Every time you ski down, the slope gets more ingrained, it's really easy to do, it's already right in front of you. You just kind of ski down, right? You don't have to choose your path, you don't have to think, it's just the routine of, this is me, this is how I see the world. The default mode network is effectively the way that our brains talk, the parts of our brains talk to each other in default, which also seems to be consistent with our sense of ego, our sense of how we see ourselves, okay? So the more we think about this, the more that we think about ourselves in any way, or the more we think about the world around us in any way, the stronger that thought process gets, down to the way that our neurons are actually talking to each other. So the entrainment, the DMN, the default mode network, actually gets entrained over and over and over again the more we repeat doing anything. Practice makes perfect. Eric Kandel won the Nobel Prize in 2002 for showing this very thing. And so the default mode network is important though because it keeps us in the realm of what we know. It keeps us surviving in modern society. However, psychedelic states and psychedelic medicines and meditative states, these do something different. It's like, imagine you get to the top of the mountain, and it's the same mountain you've always been skiing on, and all of a sudden 8 feet of powder just drop on top of you, and you don't know where to go. You can in fact go anywhere. You can choose your new path. You can choose any path you want. In fact, paths that you would have never thought to take before now become obviously apparent to you. That is what psychedelic states are doing to the brain in the way that they gradually, and psychedelic states, I mean drug or not, are gradually reducing the default mode network activity in favor of newness, in favor of exploration, rediscovery of self, learning. And we now know, and I'll get to it in a sec, that psychedelic medicines actually improve neuroplasticity. They help neurons grow and build stronger connections. So, I mentioned Eric Kandel earlier. He is one of my incredible role models in neuropsychiatry, won the Nobel Prize in 2000. And he basically discovered, and I'll summarize his entire life of work in one slide, which is basically by studying these little guys over here, these ancient 300 million year old sea snails that have just 12,000 neurons, when we have like 100 billion neurons, that these guys form memories the same way that we do. And they form memories to safety things that make them feel safe, and they form memories of things that make them feel threatened exactly the same way as we do. And that's pretty crazy, because we think that we're the best, and they're basically the same in terms of the way our brains work. I mean, really humbles you, right?
Yes.
So the reason why this happens is because there are unifying principles of neuroscience that most of us weren't taught. I wasn't taught these in medical school, at least not taught well. And ultimately, these should be taught to everyone. And I'll share them with you today, which is the thing that our moms or dads told us when we were growing up, or our role models told us growing up that most of us ignored, that whole practice makes perfect thing. That's actually true. For every single thing that we do. You practice telling yourself you're a shitty person, guess what you're going to become? You practice telling yourself you're an awesome person and doing things that reinforce your awesomeness, practicing gratitude, practicing forgiveness, compassion, self-love, showing those skills to yourself, you strengthen the neural connections around those skills to the point where it becomes so easy to show gratitude to yourself and others that you don't even have to think about it. It's just part of your life. And these guys do that too, although they don't really think about it in the same way, they just do it. So the reason why this is really important is because it's not just about the way our neurons talk to each other, that's just the start. The neural networks are the way we can kind of look at this visually through like fMRI scans and scans of the brain. But what's more important is that this isn't just about our brains and our neurons, it's about the way that our DNA expresses itself. Because our DNA, which is like 99.9% the same in all of us, because we're human first before we're anything else, which Francis Crick, who won the Nobel Prize, discovered, and that was like his thing. As well, when he discovered the double helical structure of DNA, is that, yeah, kind of like that. It's so cool. This is great. This is like my most fun place to speak. Awesome. All right. So this DNA that you're seeing spiraling here, effectively, you can imagine this as DNA. It has all these little blue things circling around on it, and those blue things are actually modifying which parts of that DNA are turned on or off, up or down at all times. Our whole existence is happening even when we're in the womb. And what happens when we experience intense stress, trauma, like I was talking about earlier, where we have intense, powerful, meaningful experiences that stick with us over time and cause us to feel like shit for sometimes years. This is changing, thanks to Rachel Yehuda's work from Yale and Mount Sinai. We now know that this is changing the expression of our stress response genes. It's changing the way we receive cortisol. It's changing the way our cells function, how well they metabolize nutrients, how well we absorb nutrients in the gut, how good we feel because of how much appropriately our nervous system and neurons are talking to each other. It's not just about the neurons in the brain, it's literally trauma and stress and life experiences in general affects every single part and every single cell in our bodies, down to our gametes, our sperm and egg cells. Because they also have our DNA in it. They only have half, but they have the same little blue things that were circling around earlier that are modulating and modifying the DNA to tell which parts turn up and which parts turn down. It's why our skin cells, which have the exact same full DNA that our brain cells do, our skin cells still know to be skin and our brain cells know to be brain. How do they know? Epigenetics. Epigenetics is the code that tells which parts of the DNA to turn on in skin and turn off the brain stuff in the skin, and then turn on the brain stuff in the brain and turn off the skin stuff in the brain. That's how our bodies differentiate into our full, diverse milieu of human beings in every animal. And so what Rachel showed that was truly brilliant, and I think she may be one of the next candidates for a Nobel Prize in medicine, is the idea that not only does stress and trauma actually cause changes to our DNA expression patterns of stress response genes like cortisol and the receptors for cortisol, it actually, if it's not resolved, gets passed on to our offspring. Because it changes the DNA expression in our sperm and egg, and that gets passed on to our offspring, which means that it's not like you have a genetic predisposition to PTSD. It's not about the DNA. It's about epigenetic, what's on the DNA. And that can be changed. Genetics, DNA, cannot be changed. It can't be changed naturally. It is unnatural to modify DNA. It's very, very challenging. The body has its own ways of doing it to repair, but it is very, very difficult to do in any kind of scientific, safe way. However, epigenetics, what's on the DNA, that can be modified all the time. So what I'm trying to tell you is that if you treat your trauma, if you do your work, you don't just help yourself. You don't just help the people around you in your immediate life. You literally save your children. You save your offspring. You save not only the next generation, but potentially up to 14 generations we can pass this information on. In animals, it's at least 4. But in animals, they're in a lab, so their safety be controlled. We're exposed to unsafe shit all the time. It creates a lot of problems. So again, maximizing adaptation is critical. And what's really fascinating also about this that I mentioned earlier is that we now know that, I guess you can't see this, but ketamine and psilocybin have been found to increase the way our neurons talk to each other and increase how much they talk and how many neurons we have. And it looks like ayahuasca and the components of ayahuasca like DMT, harmine, they actually induce very similar effects. And so why is the idea that Terence McKenna came up with long ago about food of the gods, that we evolved from monkeys because monkeys ate mushrooms by following animals around, so interesting? Because mushrooms and eating them over time actually increase the amount of neurons we have and increase the way they connect to each other. They effectively increase what we call the neural substrate of consciousness. It is evolution in process. So, all of that said, take a deep breath, that was a lot. Future of mental health involves unlocking the mechanisms of psychedelic medicines so that we can improve access to care. The biggest tragedy in mental health right now is that we know how to fix people, but people can't get access to it. That is a real problem. It's hard for us as much as it's hard for the patients because we went into this to heal. All of us as clinicians went into this to heal people. We have the tools. They're illegal. They're restricted. You can only use them in a certain way and you get penalized by your hospital administration, whatever it might be. This is the reality of the life we're in. Insurance won't pay for it, so you can't get it, right? This is the reality we're in. So how do you fix it? Well, I talked to Rick Doblin in 2016. First time we met in person at Horizons. Couldn't have been more excited. And Rick at that time in his life was doing incredible work and said, you know what? I don't really care about the mechanism of how psychedelics work. MAPS was devoting no resources to it. They weren't thinking at all about how psychedelics work, and the way that the process, the mechanisms, the kind of stuff we were just talking about. All they cared about was that they work, and that they work safely, and that was all that MAPS was concerned about, which is important. It's probably the most important. But secondarily, we still need to be doing work to show how. The main reason is because most people are not good drug candidates. Pregnant women, children, elderly folks, nursing women who have just had kids, and many others who have chronic illnesses are just not the best candidates for psychedelics. That's okay. If we figure out the mechanism, we can develop technology that can help us to replicate some of these safety-stimulating effects of psychedelics without drugs. This was the mission that we set out with Apollo. How do we develop a technology that takes what we know about how psychedelics amplify safety in the body neurochemically, and then use through soothing touch the skin to remind the body that it's safe, not just in your psychedelic medicine session, not just in your therapy session, where you have somebody that you're paying to just listen to you and not judge, but on the go in your day-to-day life, having something on your body that just reminds you that you're not running from the lion. And also the secondary part was, how do we develop more objective biomarkers like HRV that can actually help us predict treatment responses to enhance outcomes and figure out who's going to respond the best? And so Apollo is a technology that came out of my work at the University of Pittsburgh. It's a wearable technology. I am wearing it right now. We actually have much more attractive ones for sale now at the Apollo booth that will be shipping in about 4 weeks. But if anybody wants to try it, you can meet me at the Apollo booth after this, and in the outside area, in the back. And this technology is effectively a vibratory soundtrack for your skin. I think a lot of us have wondered what it would be like to walk through life with our personal favorite soundtrack playing all the time. We can tell because when we walk into a room or you get into a car and you're in traffic and the favorite song is on the radio and you're having a horrible day, you forget that you're having such a horrible day, because you're in the zone with that music, you're in the zone with that experience. Somebody gives you a hug and you've really had a rough time. You're not thinking about your rough time anymore. You're in that hug, especially if you trust the person. Apollo takes the understanding of how touch changes the nervous system, how touch brings us into a state of calm, balance, restoration of mind-body centeredness, the same effect that you get from deep breathing, the same effect you get from hand-holding, soothing touch, ocean waves washing over you, and it brings that home so that you can wear it and control it at any time you want. That is what we sought to do. Safety in a wearable hug you can take with you. And this is some of the data that we just got from a recent study that is ongoing. We actually have 1,500 subjects now, but this is over 582 people that have been wearing Oura Ring for 5 months. This little guy here, which tracks heart rate variability, tracks sleep metrics. It's the most accurate wearable consumer-grade sleep tracker on the market, and it also tracks heart rate and cardiovascular metrics. And so we said, when the pandemic happened, all of our in-lab sleep studies got squashed because all the sleep labs closed because we were worried about COVID. And so I said, you know what? I don't really care about being in a sleep lab. Let's just ask our customers how many of them have Oura Rings to see if they'll share their data with us. And we did. And we got over 1,500 people sharing their Oura Ring data with an average of 5-month baseline before using Apollo. And then we compared how their Apollo use changed their body. And what we saw was astonishing. Truly astonishing. In that by using Apollo for 3 hours a day, just by having it on your body and vibrating, like an hour in the morning, 2 hours at night is the most common, 5 days a week, we were seeing improvements that were equivalent to what you see with 30 minutes a day of exercise. Adopting a new exercise routine for 30 minutes a day. These are equivalent to comparable to the best results you see from people adopting new exercise routines, new daily meditation routines, new yoga routines that are published in literature. Currently, 11% average increase in heart rate variability. Resting heart rate reductions by 4%. This is over as little as 2 to 3 months. Average heart rate down 4%. And for sleep, 19% average increases in deep sleep. 19%. 14% average increases in REM. Total sleep up 6%. Why is this interesting? Because when people feel safe, this exact same stuff happens. We don't know it yet because studies haven't been done, but it's very likely when people have safe psychedelic experiences in therapy, we will also see comparable results as to this. And what's really interesting is, in addition to that, is that we've done studies of people that are ongoing currently in treatment-resistant PTSD populations with Apollo, and we've seen comparable results with people with treatment-resistant PTSD and regular PTSD and depression using Apollo over anywhere from 4 to 30 weeks, where they're seeing similar clinical response rates in terms of their symptoms that we see with MDMA and psilocybin. How is it possible? Touch is a powerful thing. Touch is actually the most powerful thing. Remember that. When you are touched by a loved one, when you're touched by somebody you trust, when you touch somebody that you love, and you show affection to them, and touch can be physical, it can even just be making non-judgmental eye-to-eye contact, empathic listening, showing somebody they're truly being heard. And you're just not waiting to speak, you're actually hearing them and not judging them. You're just actually taking it in and letting them know that with eye contact. That triggers all the same neurotransmitters in our brains that we get from cocaine, MDMA, things like psilocybin, LSD, you name the drug, opioids, benzos, all alcohol, all the same stuff that we use drugs for are all released by soothing touch naturally and for free, without side effects. In fact, not only is it without side effects, it actually trains us to get better at self-inducing these states. So, we all need more touch in our lives. There are lots of different options. Where do we go next? We started a walk to actually prove whether this was what was going on, to actually show it. Because this is all, up until this point, all I've told you was the original theory behind why we do what we do. To show it, we had to look at the epigenetics, right? We had to look at the DNA. We have to know if the DNA is expression patterns of cortisol genes are changing in response to trauma. The cortisol receptors are not functioning right, and the cortisol itself may not be functioning right in response to trauma or multiple traumatic events, like Rachel studies Holocaust survivors. Then if we give these people MDMA-assisted psychotherapy, or we give them Apollo, and they're clinically looking better, theoretically, their cortisol receptor gene function should be working better. We should be able to detect this in what we call the epigenome, or the epigenetic code. And so we did that study, which is currently ongoing with MAPS. It's a collaboration between MAPS, Rachel's group at Mount Sinai, group at University of Southern California, and University of Mexico, and Yale, and MAPS, and the Modern Spirit nonprofit. And we organized a study to take the biological samples from every single subject going through the MAPS phase 3 trial for treating PTSD with MDMA, which is currently also ongoing, and comparing the epigenetic code of people who have never had MDMA to people 12 weeks later after they've had MDMA, and to see if people are getting MDMA and they're clinically getting better, their symptoms are getting better, all the symptom scores are fantastic. Are there objective markers that actually show, yes, indeed, this person's DNA is functioning better, they are working better, biologically speaking, they are better. And in fact, the preliminary data that just came back is extremely exciting. It's under review right now, and it showed exactly that. In fact, it was better than what we suspected. And it was only 20 subjects, but the fact that we could show that the cortisol receptor, one particular part of the cortisol receptor gene that is impacted by trauma, actually reversed its impact and reversed the amount of what we call methylation, which is the primary epigenetic response that we measure, by MDMA, was not only induced by MDMA, meaning, let me try to say this a different way. Trauma causes changes to our cortisol receptor function. MDMA-assisted psychotherapy in the MAPS protocol reverses that change. That is what we show. But what's more important is that the amount of benefit that people got from the MDMA, the people who did the best, had the most epigenetic revision, the most change, the most biological reversal. Who would have thought? Body and mind. We're so connected. So, the DNA samples are currently being collected. Anybody who's involved in a MAPS trial can participate, the MDMA trial specifically, which is very, very exciting. And we're also starting, and because of this work and how promising these initial preliminary results are, we actually were able to partner with a VA hospital that constantly, VAs are struggling to treat PTSD, but they're not quite ready to fold in psychedelics. I think the Bronx VA that Rachel's at is the only one in the country that is ready to bring in psychedelic treatments. So we found a VA, actually they found us, in Colorado, that said, we want to study Apollo. And in fact, not only do we want to study Apollo, we want to pay to have a study there, which never happens at the VA. For anyone who's worked at the VA, they'll pay for anything. Which, I guess is understandable. But this is like, blew my mind. I'm like, you guys want to study my technology, I just need to give it to you, and you're going to pay for everything? You're going to do blood, the microbiome analysis, and you want to do epigenetic analysis? Oh my God, where did I find you? You're amazing. So now Rachel and I are partnering on a study where we're actually now able to compare. The study's just kicking off right now. We can now actually be able to compare, is Apollo use over 8 to 12 weeks inducing the same, we see the clinical symptoms the same with PTSD, is it inducing the biological change, the revision of our DNA, the same way that MDMA does? Is that possible? So within a year from next month, we will actually be able to answer that question, which is so exciting. Can wearable technology actually replicate the human effect? And so I'm just saying, thank you. And this is very exciting for all of us in the field. It is just humbling to be a part of this work. And I can't thank everyone who's been working on this enough for all the hard work and effort they put in. And I just want to leave you with one last thing to circle back to the beginning, which is, again, what is trauma and why do altered states of consciousness facilitate healing in safe environments? Because trauma is one or multiple threatening, actual or perceived threatening, intense, meaningful experiences over time. This has to be something we look back on. We cannot judge our experiences in the moment as traumatizing, or they will be. We create our own reality with our words. We have to be able to look back, and at the same time, we have to be able to be in the moment with what it is we're experiencing so that we can have the best chance of overcoming whatever challenge it is that we're facing in that moment. Altered states of consciousness that result in transformative healing experiences are like one or multiple safe, intense, meaningful experiences over time. Effectively, or reverse trauma. We can reverse trauma. That is crazy. That has never, ever been known before. We can do it. It's been theorized, it's been talked about in psychology for years. We've known that it's possible. We now know it is possible. We all have the ability to reverse trauma. Psychedelic states are a tool that can help us do this. Clinical evidence and early molecular evidence strongly suggests that meaningful experiences impact the training of our neural networks on an epigenetic level, and we pass it on to our children. We do our work, we save our children. People who have had trauma, who do not do their work, statistics show their children have a higher likelihood, statistically significantly, higher likelihood of mental illness, metabolic syndrome, diabetes, obesity, heart conditions. You name it. Inflammation is effective because cortisol is an inflammatory gene. And there's a lot of other stuff going on too. Cortisol is not the whole story. But if we don't do our work, we pass a predisposition on to our children, and our children's children, and our children's children's children. So let's do our work. We can do this. Thank you.
Big Rabin, everybody. We have time for some questions.